Welcome to Nurse. Let's get started on today's topic. Hey everyone, welcome. You can call me Professor Nurse, spell Nherse, or just call me Nurse. Today I'm going to give you a brief overview and talk about what it means to be a registered nurse or an RN in Ontario, Canada. In upcoming videos, I'll be exploring what it means to be a nurse in other parts of the world as well. When you hear registered nurse, we're talking about a licensed professional who can practice in a wide range of areas. This may include clinical care, administration, education, policy, as well as research. Basically, RNs aren't just at the bedside, they're leaders, they're educators, they're innovators in healthcare. I'm going to move on to talking about education with you. To become an RN in Ontario, you do need either a Bachelor of Science in Nursing degree or what's also called a Bachelor of Nursing degree. Years back, RNs did receive diplomas in Ontario, but that has changed, though you may meet some RNs who still hold diplomas. These programs usually take between 2 to 4 years to complete, depending on whether you study full-time or part-time, as well as a few other factors. So the path isn't a one-size-fits-all. You can definitely tailor it to your lifestyle and your goals. So now I'm going to move on to talking about licensing exams. After you complete a recognized nursing program, you will need to pass the Next Generation NCLEX, also known as the NGN exam. One good thing about this NGN is that you do have unlimited tries, but you do have to wait 45 days between attempts, and you have a maximum of 8 times per year to take this exam. Along with the NGN, you do have to pass the jurisprudence exam. This assessment will test your understanding of the laws, the regulations, and the professional standards for nursing in Ontario. And finally, once you pass both exams and meet all registration requirements, you can complete the registration online via the College of Nurses of Ontario. You're going to pay the fee and practice once your status as a registered nurse is confirmed. If you do decide that you want to start practicing before completing your registration requirements, you can apply for a temporary class license, but you do have to meet those registration requirements as well. Some individuals do choose to hold a temporary license until they write the NCLEX, and I can explain more about that in the next video for anyone interested in this process. Opportunities are really diverse when it comes to the areas of work for registered nurses. Some of the most common settings are hospitals, clinics, long-term care facilities, public health units such as schools. You may find some RNs practicing in correctional facilities, the military, and even owning a health-related business, and some own businesses that aren't even health-related as well. So the career isn't just limited to bedside care. It's flexible, and you can really find a path that matches your lifestyle and your interests. Now I'm going to move on to talking about another important part about being a registered nurse, which is supervision. Depending on the setting, RNs may supervise other RNs, registered practical nurses, or licensed practical nurses. They may supervise personal support workers, patient care attendants, or healthcare aides, and they're always supervising students, which is one of the best parts about the job. The leadership role is a big part of nursing. It's not just about providing care, but also about guiding and supporting the healthcare team and others to make sure patients get safe and effective care. So that's a brief overview about the registered nurse in Ontario, Canada. If you're thinking about nursing, I hope this gives you an idea of what the process may look like. Let me know what else you'd like to know about becoming a nurse in other parts of the world. Thank you for watching, and if you found this helpful, don't forget to like, subscribe, and share with someone who might be considering nursing as a career in Ontario.